Hello, everyone. As you guys might know, my name is Kyle. I'm one of the co-directors for Mini Med School. I really want to thank you all for coming. This is our third session on dermatology and skin cancer. And we're really excited to have you all. The weather's starting to get nice, so I hope you all kind of agree this is a good time to talk about this kind of thing. So today we have some great speakers for you. Matthew Sutcliffe is our resident MD PhD student who will be giving a talk, an intro talk on this topic. And then we have Dr. Shukla, who is a third year resident. Third year attend. I'm so sorry. Oh my God, it's a long day. Third year attending today, giving the main talk. So without further ado, I will let Hannah take it away to give Matthew's introduction.
Hi, guys. Tonight I have the pleasure of introducing the two speakers tonight, starting off with Matthew Sutcliffe. Matthew is a sixth-year MD PhD student who in a few short weeks will be defending his PhD. His research is in breast cancer and it involves building machine learning models that can predict patient outcomes in response to treatments. Matthew was originally from Rhode Island and completed his undergraduate degree in biomedical engineering at the University of Virginia before joining the UNC MD PhD program. Since his joining, he's been a vital member of our program, serving in a multitude of roles within the MD PhD program, including co-director of Mini Med School for the past 2 years, and overall a light to us all. Please welcome Matthew Sutcliffe.
Hi, everyone. A lot of you know me because I've been here for a few years, so it's great to get the opportunity to give one of these talks. Today, I'm going to be talking a little bit about some dermatology basics before our faculty speaker goes. So dermatology, you might think of it as like, the part of medicine that studies the skin, but it also covers the hair, nails, and the mucous membranes, like the inside of your mouth. And dermatology is really important because skin is the largest organ of your body. It covers about 20 square feet of surface area. And the skin, which we'll go into a little bit more details in a few slides, is composed of 3 different layers: the epidermis, which is the outermost layer, the dermis, and then the hypodermis, which is the innermost. On the right-hand side here, just as an example for how important the skin is for covering the entire body, here we have percentages for what percentage of your body is covered by or the skin that covers the head. So these percentages are actually really important for things like burn classifications. When we think of burn victims, often they're at risk for dehydration because they lose a lot of moisture. And the skin, one of the functions of the skin is to keep that moisture in. So this is really important for sort of maintaining your fluid volumes. To go a little bit more detail into the layers of the skin here, again, we have the epidermis, which is the outermost layer, the dermis, and the hypodermis. These are rough approximations for how thick these layers are. The epidermis tends to be about 1 millimeter thick, but this varies a little bit depending on what area of the body you're talking about. For example, the palms of your hands and the soles of your feet have thicker skin. Then there's the dermis, which tends to be a little bit thicker than the epidermis. And finally, the hypodermis, which is at the bottom. This is the layer that contains your subcutaneous fat that helps maintain your body temperature, among other things. This tends to be one of the thicker layers that can get up to a centimeter thick. To talk a little bit more detail into the epidermis, which is one of the most important layers that we think about, it's made up of 5 different layers, or up to 5 different layers. Their Latin names are here, so if you studied Latin, I apologize because I did not, and I might butcher these names. But there's the stratum corneum, which is the layer of dead skin cells on the very outer the very outer surface of your skin, and these are the ones that are sort of falling off constantly. Below that is the stratum lucidum, so that, if you look on the left-hand side, is about this layer here. And the stratum lucidum is only present on those thicker skins, so on your palms and soles. Then there's the stratum granulosum, which is the next layer deep. This is a really watertight layer that helps keep all the moisture inside your body. Below that, we get to the stratum spinosum. This is where you start to have active living skin cells. And this is where a good chunk of the epidermis is made up of these cells. And then finally, at the bottom, which is kind of near this blue stripe here of the epidermis, is the stratum basale. This is where your skin stem cells belong. So these are the ones that regenerate the new skin cells. As they regenerate, they basically move from the bottom here up to the outer layer where they start to die and then they eventually fall off. This basal layer is also the one that contains the melanocytes, so we'll get into that in a minute, but those are the pigment-producing cells. In dermatology, we really like looking at histology images, so like taking a slice of the skin tissue and looking at it under the microscope. And this is just an example of what this looks like here, where the epidermis is like really this very top outer thick layer. Then you have the dermis and hypodermis below. And this big thing here, this is a hair follicle where like the root of the hair is down here. Looking a little bit more closely at the epidermis, I wanted to talk a little bit about what types of cells do we see here. So to start, here is like a more zoomed in version of what this looks like, where you have like these dead cells that are on the outermost layer. Now, to get to the types of cells that we see in the skin, the most common one that you're going to find are called keratinocytes. So the vast majority of these are keratinocytes. And when we think of skin cells, that's what we're thinking of. These are the ones that like are tightly connected to one another and form that physical barrier. We also have these Langerhans cells. So these are basically a special type of immune cell that acts as like the first defense against anything that might be getting inside your body. So if you think of like bacteria or something making its way into the skin, these cells can actually like eat up those bacteria and then go take it to like show the rest of your immune system and potentially mount an immune response to whatever it's seeing there. There are also things like Merkel cells. So these are one of the sensory cell types that exist within your skin. So there's a lot of different things that we sense, like you could think of like, like a deep pressure might be different from like a pinprick. These Merkel cells are one of the sensory cells that senses like light touch, which are different from ones that sense more like deeper pressure. Next, we also have the melanocytes that I mentioned before. These are the ones that produce melanin, which is the dark brown pigment that the melanocytes will produce, and then they'll basically like stick it into the keratinocytes. So it's not just the melanocytes that are pigmented, they will like produce that pigment and then spread it around in all of the keratinocytes. Melanin gives some protection against UV radiation, but I will let our faculty speaker go into that a little bit more in detail later. And just to note, like, so we all come in different skin tones. Some of us have like darker skin than others, and the difference is not the number of melanocytes that we have, but it's basically how active those cells are. If they are more active, they're going to be producing more melanin, and you'll have darker skin tones. As far as some of the functions of the skin, we've already touched on some of it a little bit, but just to reiterate, one of the most important functions is acting as a barrier just to any toxins or chemicals that might get in. I mentioned on the previous slide that the skin is important for melanin production, which helps protect a little bit against UV radiation. The skin is also very important for thermoregulation, so regulating your body temperature. And here you have things like sweat glands that can essentially put water onto the surface of your skin where it can evaporate, and that can produce a cooling sensation. I also mentioned that sensory cells exist within the skin, and those are very important for these various things that you see here. And then finally, the skin is important for vitamin D synthesis. So vitamin D is important for like bone production. So when you're told to like go outside on a beautiful day like this and get some vitamin D, this is why you're doing it. One of the important things in dermatology is being able to describe what we're looking at. It's a very visual field. So here I'm just showing a bunch of examples of different skin lesions, and it's important in dermatology to have like a common vocabulary for what we're describing. So you might want to just say that like here we're seeing some like darker patches. On the right, we're seeing some lighter patches. This one looks like pretty round and smooth. This one looks like it might be filled with pus or something. But we do have like official words that we use for these to help describe them, which can be important for communication amongst physicians. So this slide is a little bit overwhelming, but it just gets at some of the terms that we use. So on the left-hand side here is just an example of normal skin. We've looked at a similar picture like this before. And then on the top row are a few examples for how we can describe these. One of them, if you can read this text, is called a macule. So this is where we have like small, basically like flat lesions that are on the skin. They're not like raised or bumpy or anything, but they might be a little bit of discoloration or something that's less than 1 centimeter in diameter. And that's in comparison to what we call a papule, which is about the same size, but here we do start to see that it's a little bit raised. And then briefly, like there are also like bigger things that we might see. So nodules would be an example of something that's like bumpy, that's bigger than 1 centimeter. And then another example would be like a plaque, which instead of being like a smooth bump, if you think of it as like a plateau, it's kind of like raised, but then flat on top. That is something we could call a plaque. There are other examples on the bottom here when we start to think of like, is there something inside this bump? Like, is there pus or is there anything else that could make its way in there? And we have terms for those as well. Because we also wanted to cover skin cancer, I just wanted to give like a brief introduction. We're going to talk about this a little bit more later, but skin cancer, there are 3 main types. The most common one is called basal cell carcinoma. So I mentioned those like cells on the stratum basale. That's kind of where those cancer or those cells can be found. This is the most common type of skin cancer. It makes up about 70 to 80% of skin cancers. And I should also just note that skin cancer is, or all of these types in total are extremely common. Like when we're talking about like most common types of cancer in humans, we usually just like remove skin cancer because it's by far the most common and then like consider everything else. After basal cell carcinoma, the next most common skin cancer is squamous cell carcinoma, which makes up about 20 to 25. But the one that you've most likely heard of is melanoma. And although that makes up less than like 5% of skin cancers, it is like the most, I guess, potentially dangerous one. And that's why there's a lot of focus on that, and you've probably heard of it. Risk factors for all of these skin cancers include things like older age, which might be tied to like, the amount of UV light exposure that you've had over your lifetime, as well as lighter skin, which we mentioned these 2 things are related. And then for certain types of skin cancer, there are other risk factors like HPV infection, particularly for squamous cell carcinoma. And then of course, with all cancers, there tends to be like genetic predispositions. I'm not going to go over this point too much, but like when we're thinking of diagnosing a melanoma and like we see like a weird bump or like mole or something like that, and we're not sure whether we should get it checked out, there are things that dermatologists like to use to like look at the lesion and decide how suspicious it is, basically. And all this boils down to like, is it symmetrical versus not? Is it like very irregularly shaped? How is the border? Is it like very clear where you could draw a line around it? Or is it kind of like a gray area? We also consider things like color. So is it like a single color, or do we see like different shades of brown or red? And then we also consider things like how big it is. So bigger things tend to be more concerning, as well as how fast is it changing. So things that are changing faster tend to be a little bit more concerning. On the next slide, I have a few examples of melanomas that we can take a look at. So here, there's just 6 examples of melanomas. They all look very different from one another, but you can tell for the most part that they're all like pretty irregular. And although like not all of these fit every one of the ABCDEs that I had on the previous slide, we basically just use that as like a rule of thumb to decide like whether we should biopsy it, which can be the really definitive test. One of those biopsies might look something like this on the right-hand side here, where we know this is melanoma. We're taking a look at it under the microscope, and it might not look too different, but one thing that we can notice is that like we do see monocytes that have made its way like out into the outer edges of the epidermis. And then there's also like cancer cells. I'm not a pathologist, so this is not my area of expertise, but there are also like cancer cells down in this like blue shaded region here. So it can be tricky to diagnose if you are not trained for it, but that's why we have other physicians that can help us. So to summarize, as I said, like dermatology is a very visual field. It's important to understand what you're looking at. And to get a deeper understanding, we can do biopsies to help confirm the diagnosis. As I mentioned in the beginning, dermatology focuses on more than just the skin. It's important for hair disorders as well as like things that affect the nails. I didn't cover any of that here, but like those things are also very important. And then finally, like many other medical medical conditions can also manifest with skin, hair, or nail findings. Things like chronic inflammatory conditions can affect the skin. Infections, of course, can affect the skin. And things like allergic reaction can cause like hives and things like that that we can also have skin findings for. So that's all I have for right now. So thank you. I'm happy to take questions, but I also won't be offended if you want to save your questions for our actual doctor. Thank you.
You talk about different layers of the dermis. I've heard a lot lately about the fascia being another body-wide organ. Is that not part of dermatology? Is that something else?
I think that's like the next layer deep. It's like underneath the hypodermis. That's basically like the outer layer covering all of your organs, is my understanding. So I think that's probably like where you draw the line between like what's under dermatology's realm versus what's more like internal medicine doctors. Yeah.
Somebody else's department.
Yeah. We have to draw the line somewhere. So. Okay, thank you.
Next up, we have Dr. Shweta Shukla, who is a dermatologist at UNC Health. Dr. Shukla earned her medical degree from the University of Maryland School of Medicine, and then went on to complete her dermatology residency at the State University of New York Downstate Medical Center in Brooklyn, New York. Dr. Shukla is committed to evidence-based, patient-centered care. She provides comprehensive dermatologic care for adults and children with clinical interests that include medical dermatology, skin cancer surveillance, and medical education. She emphasizes clear communication and shared decision-making to ensure patients feel informed and supported, and she's actively involved in academic medicine and dermatology education as part of the UNC community. Please welcome Dr. Shukla.
All right, well, very nice to meet you all. I'm super excited to be here. When I heard about this talk, I was like, this will be very fun because mostly I get to see the community and people when they come to see me as patients and not before that. So I am super excited to chat with you all. I want this to be really informal and just, I have something prepared, but we don't have to go through all of it. What I want for you guys to get out of it is just get any sort of like questions answered or things you would have wanted to know or things you might want to know before you even go to a dermatologist. So I will try to kind of do my best to talk about things that I wish patients or people knew before they even got to me, maybe even many years before they got to me, 10 years, 20 years, things that would have, you know, helped them before they got to me, before I treat things. So feel free to chime in at any time, ask questions, interrupt. I want it to be interactive. It is really boring to talk at people for an hour, and I don't want to do that. So please don't make me do that. I will kind of do my best. Feel free to hop in, interrupt. We can kind of go over some of the stuff. We will skip some stuff if there's other stuff you're interested in. The only thing I can't do is offer any specific medical advice to specific things. So if I had a penny for every time that happens, I probably wouldn't be working anymore. But yes, so we will get started. Okay. So things I'm going to kind of go over is how should you take care of your skin? Because that is a common question. And I see all this insane stuff over the internet about all the kinds of things that you should be doing. What kind of sunscreen should you use? Because that's another common question. And also often maybe people think that they need to be using all these really fancy expensive things when that is not the case. What should you actually go see a dermatologist for? Does everybody need to go see a dermatologist? And then just kind of some other things that people think may be true, or something has popped up here. Let's see. It's like a Citrix thing that popped up, or is there a way to get rid of that? Sorry, I'm gonna just let you do that. Is it gonna keep popping up? No, because that's what happens to me. Okay, things that people think are maybe true, but things that I would like to kind of dispel. So what should you do to take care of your skin? What skincare routine should I have? Any guesses? What do you guys think?
Should be at least 20 bottles.
Seems like this person thinks that's true. Moisturizer, great. I like that. Talc, okay. What else? Any other thoughts? Sunscreen, I love it. A plus. Say that again. Retinol, yeah, that's a really common question I get from some people. It may be right from some people, may not be right for others. Yeah. That is a really good question. We're gonna actually, that is gonna come up a little bit later. Yeah. There's certain kinds of sunscreens people are allergic to. If generally people are allergic to sunscreens, we recommend doing like a physical sunblock rather than a chemical one. But I'm going to actually go into that a little bit later because that is a very common thing that like comes up for people. So just a basic skincare routine that I think this is really all that people need to do. You don't need 20 steps, right? You need a gentle cleanser. So there's a lot of cleansers out there. There's the ones that have the little exfoliating beads. There's things that have glycolic acid, salicylic acid. You'll see all these different medicated ones. We actually recommend not to get a medicated cleanser or anything that has any active ingredients because it's actually quite irritating and harsh for the skin. It can end up leading to like more irritation and dark marks, redness, like itching. And so anything that's like very, very gentle is what we recommend. Usually people recommend washing your face twice a day. Probably really mainly you need to wash your face at night when you've kind of had the day's grime, but that is fairly standard. And if you're sweaty, you're getting like grimy, but just being very gentle. You don't have to rub or scrub or be really aggressive with your skin because that actually can make things a lot worse. The other thing that you need is just really moisturizer and sunscreen. Same thing with moisturizer, a very gentle one. There's lots of different fancy ones out there. I promise you that anything that you buy at like CVS that is like gentle, that is like affordable is just as like good as it needs to be. Like just because it's more expensive and more fancy doesn't actually make it a better moisturizer. And sunscreen, that is really the other big thing you need. And we're going to go into sunscreens in detail in a little bit about like what you should look for and what you should do. But the big thing is you want to wear a sunscreen that's at least SPF 30 or higher, but really just 30. You don't need like 50, 60, 70. Anytime that you're outside, right? Whether that is like you're in your car driving, right? UV light comes through the window. Even if it's like a cloudy day. So whenever you're kind of in the sun, try to wear a sunscreen. Anything that is exposed should have sunscreen on it, unless you're kind of wearing sleeves and such. That's really about all you need to do. It's not particularly fancy. It's just maybe like three steps without kind of all those the retinols and the vitamin C and all of that, those things can be helpful for some people, but it is very specific because they can actually often be very irritating for other people. So at that point, I would say it may actually be helpful to go see a dermatologist if there are specific concerns that you have or things that you're trying to target with some of these other products like vitamin C, niacinamide, like retinol, kojic acid, like all of these things that you'll see. They do very particular things and are just not suited to everybody. Mm-hmm. Yeah, totally. Yeah, exactly. People tend not to wear sunscreen in the winter because they go out, they're like, it's not so sunny, but the UV light is still coming through. So even in the winter, even on cloudy days, people should really be trying to wear sunscreen. So these are some examples of gentle products. I have no disclosures or anything. These are just things that are like affordable that I recommend to my patients that are kind of like simple products. CeraVe, Dove are pretty reliable. Vanity cream is great for people that have like extra sensitive skin. Some other examples, same thing, mostly a lot of kind of CeraVe products. CeraVe and Cetaphil are kind of like a good, and Dove are good standard gentle things to go for anything, whether that's like moisturizer, sunscreen, that kind of thing. Any questions?
Caffeine.
Caffeine.
I just saw one that had caffeine.
Yeah. Again, not specifically recommended. It can be recommended maybe for specific people. It's not something that I really ever recommend to patients for anything in particular. It's supposed to help close up the blood vessels, and that helps things look less dark because they're closed up. So that's why people use it sometimes. Yes. Moisturizers and what? Lotion. Okay, okay. So that's a really good question. Lotion is also a moisturizer. So when you buy anything, right, it will either say, this pointer works, right? It will say, may say, it's just moved very fast. Where is it? Okay, this is not working for me. Okay, so it will say lotion. So lotion is something that comes out of a pump bottle. You can squeeze it out. It's a liquid. Anything that's like a white solid cream, like the CeraVe moisturizing cream, you scoop out of a tub. That is a cream. So it's kind of more what the formulation is. Then you have something called ointments. So if you think of Vaseline, that's an ointment. It's like greasy, it's thick, it's like clear. And so what it just means is that it's just how it's made. So lotion is like thinner, it's more liquidy, whereas an ointment or a cream is very, very thick and you have to scoop it. Doesn't really matter too much what you use, but things that are actually thicker are most moisturizing. Like people come in asking me, what moisturizer should I buy? And I'm like, Vaseline, and they don't want to hear it because it's really like more affordable than other things apparently. Yeah, it's boring, right? People want something exciting, but Vaseline is a great moisturizer because it's very occlusive and it's like thick and it's super greasy. So it just really keeps the moisture in really well. But you know, if you don't like greasy things on your skin, a cream might be a good idea because it's also very thick, but it's not quite greasy. And if you want something even thinner and lighter, then a lotion might be better because it's thin. Yes.
I'm always hesitate to just anything that you have to hand in to put out. I just worry about
That is a good question. I don't think that's really an issue, right? If you think about it, for the most part, I mean, you could try to wash your hands, right? But everything on your skin is kind of exposed to like the outside world anyways, right? And I think as long as you're not sticking like really, I don't know, you've got your hands, you were gardening and then you decide to just stick it in your like moisturizer bottle. If you wash your hands, I think that should still be okay.
What about when someone gets like a new tattoo? Are there moisturizers that be absolutely brainless thing to put on a new tattoo?
Vaseline. I know it's not what people want to hear, but really like nothing special. Okay, either yes. Yeah, that's a really good question. It is whatever you will do and whatever it is easier. It is just frankly easier for many people to wear a moisturizer with sunscreen in it. I recommend it all the time because it's not this extra step. But really, it makes no difference as long as you're getting your sunscreen on there.
Yeah. Would you say that like tailoring your routine to what type of skin you have is important? Like if that's something that you should go to a dermatologist about, or if you can find some sort of like in a case.
Yeah, I think for the most part, I don't think it, to be honest, ends up really making that much of a difference as long as people are using gentle products. But I think if you have specific concerns about, you know, being really tend to be someone that's very dry, or you tend to be someone that tends to be very oily, it may be helpful to see a dermatologist because then they can actually guide you as to what kinds of products will be helpful. But for the most part, otherwise, most people should be okay with like a gentle wash, gentle moisturizer, gentle sunscreen. Okay, what is the best sunscreen to use? Any ideas? Tell me what you guys use or what you think people should use. The one that you use is the best one, exactly. I get this question a lot, but it really is what you will use because the key is most people are not using sunscreen enough, right? In general, it's kind of like the most important tool we have to help kind of fight skin cancer, right? Beyond like covering up with clothes, right? Like 1 in 5 people eventually will get skin cancer. These are kind of on this bottle. These are kind of the main things that you need to kind of like think about, right? So the big thing is it needs to be broad spectrum, meaning, which I think most sunscreens that are made these days are broad spectrum, so it really shouldn't be running into sunscreens that aren't, but that means it covers helps protect from ultraviolet A and ultraviolet B types of light, which can both cause skin cancer. It needs to be SPF 30 or higher. Again, it doesn't need to be like SPF 70 or 80. It really just needs to be 30 or higher. That's kind of your sort of your sun protective factor. And the other thing to think about is making sure, if you are someone that's really active, making sure it's water resistant, because they do kind of sweat off, right? When you're sweating or you're getting like wet, you're going into the pool or anything in general, sunscreen does need to be reapplied every 2 hours, you know, so people put it on in the morning and they'll kind of go out and about. And many people, I'd say most people are not reapplying through the day, which I know is really tricky and it's kind of annoying. And like I'm guilty. I'm sorry. Like it's really hard to whip out your sunscreen every 2 hours and put it on. But if you are like out and about and, you know, you're spending the day outside, it doesn't hurt to kind of keep some on you and, you know, reapply. Or the other option to that is just wearing like a really broad brim hat or wearing clothes. Oftentimes people will actually find that so much easier than reapplying. The other thing that sometimes people will do is sprays. Some people find sprays easier to reapply because you just spray it. It's a little bit faster. As long as you're really being generous and getting enough on there, that should still also be okay. So this is the AAD's recommendations. Interesting AAD's, the American Academy of Dermatology, they had this interesting analogy of that you need 1 ounce of sunscreen, a shot. I'm like, it's the AAD. Maybe you should have chosen a different analogy, but apparently you need apparently a shot glass's worth or 1 ounce of sunscreen to really theoretically cover your entire exposed body. I think they chose a shot glass because most people will know about how much sunscreen that is, right? And it is more than most people think. That is kind of the point. So it doesn't fully protect you, right? So it's still helpful to be in the shade as much as you can, right? Like wearing like long sleeves or long pants, like a broad brim hat, making sure like you're not missing like the tops of your ears with sunscreen. So as you know, there's different like ways, and I do have many people that choose that they're just gonna go the clothing route instead of like the reapplying sunscreen route, because that is very difficult. But those are kind of really the big things. Yeah. Yes, I think that's coming up. Okay, so physical sunscreen has titanium dioxide and zinc oxide in it. So what that means is it like kind of physically like blocks the sun. So it's the sunscreen that you'll see that is really, really, really white, and it is very hard to rub in. And no matter how much you rub it in, you still like have this white cast, and it can be annoying, and a lot of people hate that, which is why there's also chemical sunscreens. There's different chemicals, and there's oxybenzone, avobenzone, all that stuff. These work differently, and then they kind of help absorb like the UV rays, and there's a chemical reaction. It kind of just then protects your sun. So both are fine, to be honest. It goes back to it's whatever you will use, right? So I don't really care what sunscreen it is that you're using, whether that is physical or whether that is chemical sunscreen. A lot of people do like the chemical one because it doesn't have that white cast on it. But in general, if you do have sensitive skin and you get rashes, that kind of thing, a mineral sunscreen is a whole lot less irritating to most people. That's a good question. I'm not sure I know the answer. I will give you my best hypothesis, which is that I think it could make a difference if the UV rays are kind of breaking some stuff down. In general, like your skin is gonna degrade more in areas that you don't have sunscreen on. So I can see a tattoo ending up looking different over many years, but I'm not actually 100% sure. That is a great question. Okay. So what is SPF? I feel like many patients or people will come in and be like, I need an SPF like 80 sunscreen or something. You don't. So the way that the sun protective factor works is it's kind of this, it's a graph where it like sort of exponentially sort of goes up, but SPF 30 actually covers 97% of the sun's UV rays. So you actually don't need like an SPF 60, 70, 80. That's getting to that last little 3%. All we care about is that the majority of the UV rays are blocked. So at least SPF 30 or higher, and then again the clothing options. The other thing that you can look for these days, I think most especially like the outdoor stores will have like UPF clothing. They'll have like UPF hats and like sleeves and like other stuff, and you'll actually see a UPF rating on there, and it'll be like UPF whatever for like this many number of washes. So after you've washed it that many times, maybe like not so reliable. But a lot of those are actually great lightweight options. And I know people think that wearing long sleeves, that kind of thing, they'll actually be like hotter, but actually it actually is, you actually will feel cooler if you're wearing things that are kind of like lightweight, like without like all of that sun. It can actually feel a little bit like cooler. So that is like the other kind of products that you can look for instead of using sunscreen. Okay, how do you correctly apply it? Because this is like the other things. We already talked about this a little bit, but you should really be putting it on maybe like 15 minutes before you go outside, so that you're not kind of like burning. It's sort of getting in there. We talked about making sure that you use enough, right? And about for your face, we recommend maybe about like 2 finger lengths. So for your body, a shot glass. So if you put it on your face, maybe like your pull to like fingertips, that's like a good rule of thumb, or about like a teaspoon for your face. And then also remember getting like a lip balm, right, that has some SPF in it as well, because people often forget to protect their lips. Lips do get skin cancer. I do see it, not infrequently. And then we talked about every 2 hours and making sure, especially if you are sweating or swimming, that kind of thing, you are putting it back on again, because if you are wearing sunscreen and you still get sunburn, it just means that you probably didn't have enough on. Okay, I think we mostly really talked about all of this stuff, so I don't want to be redundant. The other thing to think about is shade, right? So 10 to 2 are kind of like the peak like UV ray light hours. So if you are doing outdoor activities, maybe a little bit earlier or a little bit like later. And then obviously not tanning is very, very helpful, because tanning, as we know, really contributes a lot to skin cancer. Some examples of sunscreens, because I know people ask this a lot, right? Same products, same brands as I mentioned before: Neutrogena, Aveeno, CeraVe, anything that is basically very, very gentle. Okay, any questions there? Bug spray, what about it? I actually don't know if that exists. Does that exist, bug spray with sunscreen in it? I'm learning something new from you guys. So I can't say that I have too much to say about bug spray. I know DEET, yeah, I mean, DEET, I know, is usually typically recommended as sort of like the gold standard in terms of like more like heavy duty things. I'm not really particular about bug spray. I haven't like noticed ones that are better or others, or people, I haven't had people come in to me telling me that they had issues. So not something that I particularly have recommendations on.
So is it the kind of stress that certain skin zones?
That is a really good question. Yeah, so the UV rays can damage, right, like the cells, like DNA, right, and then there's certain like mutations, and then the cells can't repair themselves, and then they end up just growing and growing and growing. And so yes, some kind of combination of like oxidative damage, UV damage, like environmental things and genetic things, where things that you can't control, right, if it runs in your family, and maybe that's just sort of how your skin is. So it's a combination of a bunch of stuff. Yes. Yeah, that's a good question. Just really gentle. You don't want to do too much, right? You don't want to be peeling or picking things off. That's like never the answer, right? That's never the answer. And so lots of either like Vaseline as well, like keeping it like cool, like don't try to put too many things on it. And it may always be like worth at least getting like checked out to make sure it's kind of not a severe burn, but they will heal on their own with time. I think that is soothing as long as it doesn't irritate people, but you have to be tricky, and there's stuff coming up on this. Natural products are always like kind of a slippery slope, because they often end up being a lot more irritating, and so it may be, depending on how it's sort of formulated, it may not be the best option. I think there was something over there, yeah. Yeah. The same brands have like chemical sunscreens. Yeah, they do. Yes. That's a good question. Maybe it depends on the person. Some people, if you're very like sensitive skin and your face is more easily irritated, you may want to get like a particularly like gentle sunscreen and then something else for the body that you will put everywhere. But otherwise, not necessarily. You don't need it. The only thing is, some of the smaller bottles that come of sunscreens, you probably don't have enough to be putting all over on your body. So you may want to get something that is a little bit more like bigger bottle of sunscreen. And so some of the more sensitive sunscreens do come in smaller bottles. So people usually do just use those on the face. Okay. All right, should I get the spot checked out? So this is kind of like the other thing that I wish people knew, like when should they actually like come to see me? Like what should they actually be looking out for? Right? Because you don't know, right? You don't know what you don't know. So it's really, really hard to know. So I wanted to take some time to go over like what are the things that I would want you guys to be looking out for. So I think Matt talked about this a little bit, right? The ABCDEs are sort of what we talk about. I'll go over them in a little bit more detail. So A stands for asymmetry, right? So let's say like, I don't know, like for instance, you can fold a piece of paper in half, right? It's perfectly symmetric. So if spots are more like asymmetric, like you don't think you could kind of draw a line through it and it would be like a mirror image, right? That's something that you may want to consider getting checked out. B is for border, right? So if it has like really smooth, you could kind of like draw like easily, you could take a marker and it would be really easy for you to just like really draw all around it, and you would, you wouldn't have difficulty with it, right? Versus something that's irregular and you'd be like kind of struggling to like outline it, right? So B is for border, irregularity. So if it looks really funky like that, you want to get it checked out. C is for color. Usually things that are healthy tend to be sort of like one color, really like homogeneous and, almost sort of like pleasing to the eye, right? If things are like funky and they have like other colors in them, like it's like brown, but then there's like a part of it that looks like white, or maybe there's like a little like blue in there. There's like, looks like red in one area and like brown in another area, right? When you're seeing like that many different colors, that is something that, might be worth getting checked out as well. D is for diameter. So we say things that are more than 6 millimeters or bigger than the tip of a pencil eraser are kind of getting a little bit on the bigger size, and especially, if it's changing, which we are going to the E, right, for evolution, you yourself have kind of noticed a change, then that is definitely something that we should also check out. So those are kind of simple rules of thumb. So even if you don't know anything, you're not sure, then if kind of at least you can think back to the ABCDEs, right? And if you kind of apply it, it just really never hurts for us to check it out. It is much easier for me for somebody to come in and be like, hey, that's totally okay, versus I'm like, oh, I wish you came in for this like 6 months ago or a year ago, and now we have to, so it's just much easier to kind of be upfront and like say that things are fine than for you to come in, later, because that's what we are here for. Mm-hmm. That is impossible for me to say without putting my eyes on that, unfortunately. So I would have to look at that. But if it's at the point that someone has those kinds of questions, I would say I'd say that's worth a visit to me. Yeah, if you're wondering about it, totally. If you're wondering about something, then I think that earns you an appointment. Yeah. Not necessarily, whether it's raised, whether it's flat. Sometimes flat things can be really bad too. I think we would have to look at it, is what I tell people. Yeah. Yeah.
So what do these have to do with variability?
Mm-hmm.
What what's going on at the cellular level? I mean, actually, some cells develop in this way, comes out blue. Mm-hmm. That way comes out red.
Yeah, that's actually a really good question. Matt's lecture did actually sort of cover that a little bit with that pathology slide. If you looked at it, you saw that the cells were like more funky. They looked a little bit more scary. Melanocytes, grow in that little basal layer, and when they are healthy, like in a mole, they often grow in kind of like little symmetric nests. And when they start being more dangerous, you can see that those nests are kind of like spreading out and they're scattered and they start looking very bizarre. So on a cellular level, like the cells are just like not as organized. They look really like weird. It's almost like the ABCDEs, except on a cellular level. So you could kind of maybe draw that like analogy a little bit. Yeah. Okay. So types of skin cancers, we kind of talked about this already a little bit, but actinic keratosis is a precancer. It's probably the thing that I see most commonly. So these can just be dry, like little rough patches on people's faces. Oftentimes we can actually feel it better than we can see it. Sometimes that's why if you have a dermatologist or you go see a dermatologist, they'll be like feeling different areas. It can seem a little like funny, but it's just because oftentimes we can like feel them a whole lot better than we can like visualize them. We usually will freeze these with liquid nitrogen to sort of take care of them before they turn into skin cancer. And then the most common kinds of skin cancer, as Matt said, are basal cell skin cancer and squamous cell skin cancer. So basal cell skin cancers have kind of like these, like they're like pink like papules, kind of going back to our dermatology language. Sometimes they can have a little erosion, which is a sore on them. They can have all these kind of little blood vessels on them. And then there are squamous cells, which tend to be a little bit more like rough and like crusted, or they can even be flat. Again, they can also be a raised sort of like papule or nodule like this. So it is quite variable, but you'll still see that you could probably apply the ABCDEs, right, to many of these. And I would say that is kind of how I recommend sort of thinking about it. Yeah. Say that again? Liquid nitrogen. Mhm. Yeah, that's what we use in the clinic. We'll have a little bottle of a spray of liquid nitrogen, and we can use that to kill the precancer cells. Yes. Topical steroids, unless I'm mistaken, usually don't treat actinic keratosis. So it sounds very particular and specific, and there may be something more to that, but usually not what I use to treat actinic keratoses. 5-fluorouracil is a chemo cream, and there are other chemo creams that can be used for precancers. They can be used for skin cancers, but it is very specific to the context. Well,
besides the obvious of like, what happens if you wait?
That's a good question. Depends on the kind of skin cancer. I have some people that will have the basal cell and it's been there for like 4 years and they're fine. It hasn't killed them, but it's huge and it really is big and it's going to need a humongous surgery and it's really destroying kind of like everything in the area, but they haven't died from it because it doesn't go anywhere, right? On the other hand, if someone has a melanoma and they ignore it for 5 years, like that would really be a problem because melanomas do metastasize and they go other places. So it just really depends on the specific kind of skin cancer it is, but in general, it's better not to ignore them because eventually you will need them treated. You're going to need a bigger surgery. You might need something more extensive. They become harder to treat. So while they might seem small and insignificant, the earlier that we treat it, it's usually better. Yes, over there. That is a really good question. I think we're getting more data on like sun exposure and skin cancer. I mean, I think like it's cumulative sun damage is what we say. So any sun that you have gotten across your entire life can like contribute to damage that causes skin cancer. And so hopefully, you know, you will be around for a very long time and the more sun damage you get, right, over time is still going to cumulatively increase your risk for getting more skin cancers. So really basically never hurts to do sun protection. It's both. Yeah, it's both. Yeah. Yes, or over there. I think that is Probably also basal cell skin cancer. It may just be a different name for basal cell skin cancer. It just would depend because I've seen that name in different contexts. Yes. It can be because you don't really have any pigment in that area. You don't really have melanin protecting you, so that can certainly increase risk in those areas. Yeah. Yes.
Between the skin cancer types, is there one that's more associated with physician? And with that, should there be more concern for spots that are in places like when spots become more noticeably weird looking? Should we be more concerned if it's in a spot that doesn't see the sun ever, or that means more like related to genetics, possibly like the bottom of your foot versus like
Yeah. That's a really good question. All skin cancers, I think there's some genetic basis. Maybe melanoma is a little bit more, that we do have genes that can be tested for. But again, research is like not complete, right? We don't have data for everything. Genetic data is like always accumulating. But in general, like sun exposed areas are what we think about. But people who are skin of color or pigmented skin types like myself are more predisposed to something called acral lentiginous melanoma, which is like maybe melanoma more on the hands, feet, mouth. So anyone that's skin of color maybe has a higher chance of that. But in general, I think it goes back to if it's looking weird, if it's new, going back to the ABCDEs, it still should be something that's checked out either way. Yes.
If your mother or other parents had both of cancer, when did you start getting regular?
This is actually a very excellent question that I don't have a good answer to be very honest. And people ask me this all the time. There is a lot of controversy on how often people should be getting skin checks. Theoretically, if you have had skin cancer before, you are someone that should be getting a skin check every year because you've had skin cancer before. If you are a super young, healthy person that has never had any skin cancer issues, maybe you could get a baseline skin check and then one every several years. But there are no guidelines for us to really like have good recommendations for people. But in general, I think if it runs in your family, I think it is worth going and meeting with a dermatologist so they can actually get very detailed history and kind of information from you and give you a more specific recommendation on how often they think that they should see you. So it's very case by case. Okay. All right. So I am actually going to skip some of this stuff because we end at 7, right? Okay, I'm going to skip a lot of this stuff. I'm sorry. 7:30. Oh, we have time. Okay, then. Okay, never mind. Okay, so basal cell skin cancers we kind of talked about, right? Those are like we say like the pink pearly papules or nodules. Sometimes you can have pigmented basal cells, which make some pigment in them. So this is a little bit like more bluish brownish. These are examples of squamous cell skin cancers, right? So we talked about you can get them on the lips. So this is a exophytic nodule with maybe a like little central, like we call it an erosion and crusting. And this is kind of another squamous cell that is this like dome shaped papule or a plaque with this kind of, again, little sore in the middle. These are some examples of melanoma, right? They can look very different. It can look a little bit more black. This pointer is really fast. I can't, okay. They can look really, really dark and black, and then sometimes they can have a little bit more of like a brown appearance. And then you have something called amelanotic melanoma, which is red, which means that it doesn't look like pigmented, and that can be really sometimes tricky to diagnose. Yes. Yeah. So we pretty much will always biopsy it. That's because in order to know what we should do with it, right, we need to know exactly what kind of skin cancer it is. Many times, to be honest, I will see someone, I'm like, I know that's a skin cancer, or I know it's a basal cell, but I will still biopsy it because there's different subtypes and we still kind of want to know what's going on under the microscope level because it helps us decide like how to treat it. But this is a very individual conversation. If I have a patient that comes to me that is like 98 and they have a basal cell on their face, we may decide to do absolutely nothing with it. We may decide not to biopsy it at all, right? It just depends on quality of like life, and is it really going to impact their quality of life, right? Like I said, basal cells can grow for a very, very long time and not be really destructive, right? Versus it's a very different conversation if I have someone that's coming to me that's 20 and they have a basal cell, and then I'm like, well, we need to see you more often because you're very young. So it just really depends. But we pretty much, yes, we do biopsy everything. Yes. Yeah, that's a good question. It kind of depends on the melanoma. There are certain criteria and guidelines about once we have that biopsy result of what is under the microscope. Depending on what we see under the microscope, certain melanoma, if it's a melanoma, depending on certain features of the sub-features of the melanoma, we may decide that someone is at a higher chance of having metastases. So they are someone that will need more of that testing. Whereas if we see that it's a very, very surface melanoma, just at the very, very top layer of the skin, they may not need anything more at all. But again, that would be very individual to the specific pathology results.
Regarding metastasis, does that just happen because when normal cells are they are density and spacing resistant, like they can move wherever? Is it more like they make their own protocol, keep growing? I don't understand how.
It's a different mix of things. So melanoma, it's usually through like lymphatic vessels or blood vessels, right? So cells usually have certain features, right, that make them have certain traits, right? They're supposed to stay where they're supposed to stay, and they're supposed to do what they're supposed to do. There's like different molecules that kind of, we say, kind of home them to like certain areas, right? And then when a cell becomes malignant or it becomes like a cancer, it kind of stops like being itself, right? It starts slowly like losing different features of what it's supposed to do, and it can kind of just sort of start doing everything. And so it may not like adhere to like the area that it needs to stay at. They do like can make certain types of cancers, not it depends on the cancer, can make their own growth factors that make blood vessels, and then the cells can get in the blood vessel. So that's a really good question that has a very complicated answer.
Is it basically like the cancer's like, I'm gonna take all your resources?
Yeah, that's a good way to simplify it. It really does use up kind of all of like the local like resources, right? That's why it's better for us to cut it out sooner than later. Yes. I think that's a good question that, again, I don't have an answer to. I mean, theoretically, I guess maybe someone is more predisposed, but different cancers have different risk factors. They have different like genetic risk factors. So, there are certain genetic syndromes where we see certain types of cancer grouped together. But, it may not include other types of cancer. So that is a little bit like hard to predict unless someone has a very known, well-established genetic syndrome. But genetics is super complicated, and we don't know the majority of it, to be honest. And so we only know some like very, very particular, like very big, like name like mutations. Like everyone's heard of like the BRCA mutations, right, in breast cancer. But there's actually like a whole lot of other genes that go into breast cancers that we don't like really understand well, and it applies to like a lot of even to skin cancers and that kind of thing.
Typically having it because it doesn't do worse.
Not necessarily, yeah. But it might. I think it's hard for us to parse that out because we only see people after the fact, right? We don't know what someone has been exposed to in their lifetime. Like, we don't know like exactly like what genetics they have. So the problem is like there's not really like a good way. And the only way that you could do that would be some sort of like research study that is like very, very long that follows people over the course of their life. And you'd have to look at like a lot of different things. Mm-hmm.
I've read stories in recent years where radiologists have developed artificial intelligence do quite a good job of vaccine mammograms and or anything. You have something you can point at my skin and say,
People are working on tools like that. There are some recent like studies that have come out. They can be quite good at certain things, but not so good at other things, in my experience. So I think we're not really quite there yet in terms of it just you just being able to do that. Inevitably, you do need then a human being to look at that and sort of like vet it. But I don't know of any like apps that exist currently, but I guarantee you that someone is trying to make that right now. Yeah. Yeah, I have had people come do that and put stuff in ChatGPT and ask me if I agree with ChatGPT's answer. So that does happen. I'm already seeing that.
What about these like scanner programs? I think in Europe, particularly the body scanners, where you can go in and have your whole scan.
I'm not familiar with that. I'm familiar with full body photography. So we do that where there's like a photographer though that manually takes photos of everything. It's not recommended for the average person. It's recommended for certain people that are very, very high risk for skin cancer. But the average person doesn't need to do that. Okay. So I'm just going to go into a section of things that I think people think are true or false, or patients think that are true or false, and just kind of go over some things that I think like are sort of myths. Okay. Base tan protects you from sunburns. True or false? False. Great. My work here is done. I can go now. I unfortunately like do hear this like not infrequently. The AAD did a survey and they found out that like, you know, a lot of people, like 63% of people that responded did get a base tan, and then 45% of them believed like one of the following things, which that a base tan will prevent sunburns. Tanning is totally safe as long as you are not getting burnt. People think that a base tan helps reduce the risk of skin cancer, or that it's actually healthy. None of this is true. Getting a tan or getting no tanning at all, no intentional tanning at all is allowed, because any amount of like UV or sun damage will damage your skin. Well, as I said, skin of color also gets skin cancer, right? So not, you know, it's not necessary. So anyone that's had a lot of UV or sun damage like is more prone to getting skin cancer. And like, yes, if you have pigmented skin, then yes, you have a lower risk because you do have like melanin, but doesn't mean you're risk free, right? And even if a person that has skin of color does tan, they are still increasing their risk for skin cancer. Yes.
For vitamin D, that's actually like we need more vitamin D. So I'm not tanning, but we.
Yeah, that is like a debate that I feel like people have all the time. We usually recommend wearing sunscreen and then just taking a vitamin D supplement, because realistically, people are probably also not, I would think, out enough to really be getting enough vitamin D, right, to like meet their like supply, right, especially because of equatorially, right, where we live, right, and it has to be like certain wavelength, right, of vitamin, like if UV light, you probably have to be out at like a particular day. Like theoretically, I think for vitamin D, you want to be out like you'd be out like at peak, right, peak hours of UV light, which you don't want to be doing that. So we usually recommend wear sunscreen, and like most people do have vitamin D deficiency and should be taking a vitamin D supplement anyways. So we'll recommend that more so than sitting out in the sun for vitamin D. There isn't technically a safe way you could do it, but it's gonna whatever increase sun damage. Yeah. Yeah.
So when I guess tanning, like if you put on sunscreen, is it not possible to tan, or is that just like, I mean, some people can tan. Is that for some other reason?
That's a good question. I mean, when you put sunscreen on, it is protecting you from UV damage. Does it prevent like 100% of the UV going through? Probably not, right? There's like error in application. You're out for a while, right? And so I think you will, like, there's something called an immediate sort of little bit of a tan where your skin is like, right, is trying to make more melanin to protect you because you're exposing it to the sun. So people can get like a little bit of an immediate tan after, but theoretically with like very good sunscreen application, you shouldn't be as much. The tan is evidence that your skin has decided to make more melanin. The melanocytes are now more active and they're pumping out more melanin because the UV light stimulated them, and they need to make more melanin because in order to kind of like help protect the skin.
That melanin protects the skin cells from UV.
This is why this is the tricky thing with a base tan, right? Like logically it sounds like that should be okay, right? But you're still damaging the cells, and you're still damaging, right, like the DNA, even if you're doing that. So you're still doing sun damage in the process.
And that's just linear UV exposure.
I don't actually know if it's like linear. That's a good question. I don't know if it's like a linear curve or linear graph, but I think for our intents and purposes, we could probably say that. Yes, over. Did they do radiation? Yeah. They used to do radiation for acne like very, very long ago. I know that sounds like insanity. Maybe you shouldn't trust the medical system. No, I don't mean that. That's just a joke, but they did believe that, right? That's just like evidence to show like how much we learn, right? Like they like qualified people believed that that was like a way to treat acne. We know that is completely wrong now. The reason that it works, and it worked probably, is because it still kills your hair follicles. Like when you get radiation to your skin, it kills all of the structures, like your oil glands, it kills your hair follicles. Acne is caused by oil glands and hair follicles. So yes, it works as a treatment for acne, but it causes a lot more issues. Exactly. Yes, the cost is too high. Yes. That's a good question. Not necessarily. Some of them, yes. People tend to get more freckles as life sort of goes on and they cumulatively had more sun. So it can be a sign of sun damage, yes. But some freckles are sort of more like inherent, right? Like freckles that people have had at like a younger age that they've like kind of always had can be not necessarily from sun damage. Yes. Okay. All right. So we kind of actually already talked through all of this stuff. I just didn't go to this slide. Okay. All right. One of the most common causes of itchy skin is dry skin. True or false? True. Yes, this is probably the most common cause of itchy skin that I see. Actually, let me ask you, let me not show you that. Okay. Did you guys already see? Is it too late? Is it too late? You guys are too fast? Okay. So tell me, what's the appropriate way to take a shower? Or like bath, or whatever it is that you do, or what's hot water, warm water? Warm water. How long should showers be? Yeah, 5 to 10 minutes, right? Some people will take 20, 30-minute like hot showers. Actually, most people that come to me are taking really, really hot, long showers, right? It dries you out like quite a bit. What soaps should we be using? Gentle, right? Gentle. Anybody here use Irish Spring or Dial? No, a lot of people do. People like the harsh soaps because it feels clean, and it feels clean because it kind of like strips all your oil and it feels like very clean, but it's terrible for your skin. What do you guys use to wash your hands? Like, shower. Washcloth, loofah, washcloth. What else? Anything else? Anybody use this? Your hands. That is the right answer. So no washcloth, no loofah, because it actually dries you out more and makes you more itchy. It's a little bit harsh, so just should be using your hands and being very gentle. There's no need to aggressively like scrub your skin. How often do people moisturize, or when do you moisturize? Yeah, so after a bath or a shower is a good time to moisturize because you are a little bit moist, so it helps sort of keep a little bit of that moisture in. Those are sort of kind of like the big things, right? So people usually will shower for too long, it will be too hot, and then making sure you're using like something gentle. And then moisturizing obviously is helpful. A lot of people that have itchy, dry skin, it's because they are either doing one of these things where it's too hot, too long, or they're not really like moisturizing. But a lot of the times I will have a conversation with somebody and we will kind of work on all these things, and then I have them come back a couple months later and they're like not so dry and itchy anymore. So dry skin is a really, really common and big reason to be like extremely itchy. Yeah. Exfoliating no one should be exfoliating. There's no reason ever to exfoliate. It just irritates your skin. All you're doing is like irritating your skin and you're rubbing it, and then it's annoyed at you, and then
Dead layers.
but it's going to move on anyways because the skin turns over very fast, right? In the course of a couple weeks, those cells are generating and they're turning over and they're going to the top. So it's going to do that anyways. There's no reason to irritate it, annoy it. You know what happens when you annoy it more is it just generates more thickened skin. That's how you get really, really thickened skin, is by like rubbing and scrubbing a lot. It just gets annoyed and it's like, I am really angry at you. And okay, if you're going to do that to me, fine. I'll just make more skin. So it just sort of backfires to rub and scrub. Yes. Yeah. Picking is never the answer. Like it's never the answer. Picking like never really works. Kind of like the same thing, right? You pick and then the thing's gonna like keep coming back. So generally avoid picking things and rubbing and scrubbing. Yes. Excuse me, can you explain what that is? Hmm. I'm actually not familiar with it. I mean, I can see the benefits, potential benefits related to like lymphatic and vascular circulation. And I wonder if I think there is some data, for instance, on scalp, maybe massages and like hair growth, possibly. I'm fortunately not familiar with that enough in terms of like data for what that would do for your skin specifically. I think same concept. Yeah, I think same concept. Yeah.
For large exfoliants, like how harsh are they really? How weak is it? I know it makes more.
It does make you more susceptible to burns. Not a retinoid or retin-A or retinol is not right for everyone. That is definitely worth a conversation with the dermatologist. Some people probably could use one. Some people shouldn't be using one. There's all different kinds. You may not be using like the right one. It does definitely make people photosensitive though. So everyone that's using a retinol should also be using sunscreen. Okay. Vaseline, I think we already talked about this. If you don't want to do Vaseline, you can buy a more expensive CeraVe healing ointment. It's really the same thing. And then also Aquaphor, which is also the same thing as Vaseline. You get the message. If you don't like the name Vaseline, you can use something else. They all do the same thing. Okay. True or false? Natural products are safer for the skin than prescription or chemical products. False. Great. I like it. Okay. So people do really want to use natural things. I completely understand. I understand where that's coming from, right? Like we don't know sometimes exactly what certain chemicals are doing. I understand like the urge to want to do that. A lot of these natural products are plant or herbal products. And for many people, they might be fine, but like if you have sensitive skin or easily irritated or allergic to stuff, like plant stuff is like highly allergenic. And if you think about it, it's because mostly, right, we're not like really necessarily exposed to it, right? So your immune system can mount like a pretty robust, like annoyed response. So usually I will say like avoid kind of things that are like all natural. If you want to use them, you can. What I recommend people at least do is like do a little patch on your arm and like test it out. Make sure you're not having a reaction to it. But even then you can. This is a common thing that happens. Somebody comes to me, I'm like, you're allergic to this like perfume or you're allergic to this thing. And they're like, no, I'm not. I've been using it for 40 years. And I'm like, but yes, you are. You're still allergic to it because you can use something for a very, very long time and your skin actually does become sensitized to it and can mount like an allergic response. So just something to know about. So in general, I recommend like sensitive skin products and not kind of like the natural ones because they can cause some very nasty like allergic reactions. Okay, think we already talked about this. If I have skin of color, I don't need to use sunscreen because I can get skin cancer. That is false, right? It's a common misbelief. So if you have a darker skin tone, it's just often they get diagnosed later, right? Because there is not as much like awareness. So even like, you know, Blacks, Asians, Hispanics, Latin, Mediterranean descent, all of these people can still get skin cancer. We talked about this a little bit, right? You may be more predisposed in other areas like palms or soles or mouth or fingernails, but really anyone can be like at risk for skin cancer. These are some examples in different skin tones of skin cancer. I think we saw some of these. So these are kind of like little basal cell skin cancers. You can see what it looks like in a lighter skin type, or like a little darker skin type. There's one kind of here, little papule next to the eye. This is one that's in a slightly lighter skin tone. This is another like little, we would probably say like a little vascular sort of papule on the knee.
It's near the eye. Do you have
That's a good question. Yeah, if it's right next to the eye, I'll be like, you should go biopsy this with your ophthalmologist because it is way too close to your eye for me to be comfortable with that. But we will biopsy things around the eye all the time. So we can do those biopsies, but depending, for instance, if it's the eyelid, right? Maybe sometimes I'll send them, or if it's kind of the edge of the eyelid, it's getting close to the inside of your eye. But we do actually take care of things on the eyelid too. We have Mohs surgeons that do eyelid surgery all the time. Okay, we already talked about this too. True or false? I only need to wear sunscreen on the days it's sunny. False. Okay, I think I already beat this to death, unfortunately, so I'm not going to go over it again, but I think this is the one thing, if I could tell people in the community, right, as a dermatologist, sun protection would be like the thing that I talk about. So I already talked about this, won't talk about it again. Okay, true or false? Acne is only for teenagers and they grow out of it. False, right? Acne also happens to adults, right? Like we used to think that acne was just like for teenagers, but now, you know, we know that like there's adult acne and like adults get acne all the time. So there's no really such thing as like someone like growing out of acne. So some people are lucky and fortunate that they do grow out of acne. I am not one of them. I have acne scars. It's so common. Like everybody has acne. There is like no such thing as like perfect skin and like not having acne. Some people are very genetically, I think, lucky and they just don't, and they grew out of it as a teenager. But I will say the majority of people I see on average, they like almost ever, like many people like do have acne. There was a study that looked at kind of like adult women over 25, and they saw like that quite a bit of them like had acne, and they looked at some potential like kind of things that were correlated, maybe like genetics, like it ran in the family, maybe like some association with like what like they ate, but we don't really fully understand like all the causes of acne too well, to be honest. But the big thing to know is that like you don't necessarily grow out of acne, so it is always like kind of worth seeing a dermatologist if you are still getting acne. I see it also a big shift in women around like their 30s or 40s or 50s for acne too, because there is a change in like hormones at all of those stages, unfortunately. So you can also kind of trigger acne then. Well, kind of not, right? Because I think we see it like even as people are older. And so I think that used to be, yeah, people used to think that, but now we see it in a like much like older people too. So yeah. There are a lot of different treatments for acne. It depends on the kind of acne. I wouldn't say that there's anything super like new and fancy right now, because we've had good acne treatments actually for quite a while. And so I'd say the number one thing that people do use for acne is a retinoid or Retin-A or whatever, retinol, like one of those sort of vitamin A based products. Yes.
Is there a theory behind eating your skincare, as in like your diet contributes to, I guess, your
Controversial data on the diet thing. Not enough data for me to tell somebody to adjust their diet for their acne. That being said, I routinely do have patients come in tell me that they get acne after they have like dairy. There are some studies that show maybe like you know, processed foods, all that stuff that we all already know is bad for you, causes acne, and it causes everything else, and is going to eventually kill us anyways. So I'm not like telling anyone anything new, right? But not like, I think we truly don't have enough research to really, for me to comfortably tell somebody like you should adjust your diet, because I think that tends to cause more issues than not. People don't eat enough, they're like losing weight, their diet is too restrictive, and I think kind of like that is worse than acne. Yes. Mhm. The best thing that you can do for wrinkles is to have like worn sunscreen since, I don't know, after you were born, like immediately, right? Like the thing that causes wrinkles is like sun damage, is like is one of the biggest things. I mean, there's like a genetic component, but right, it's like your like entire life of sun damage. They can't really be fixed. There are cosmetic procedures, right? You can get Botox. There are certain like fillers, because part of actually aging is you lose areas of like fat, and those areas like need to be filled. Certain types of laser can like help with texture. So yes, it can be treated after the fact. It's certainly not easy to do, so it is better to just wear sunscreen and prevent it. And then as far as dark spots go, there are certain like lightening creams and this and that. And so yeah, all of these things can be treated after the fact, but I would agree that in general, like preventive medicine is kind of the right medicine, which is partly why I was so excited to come give this talk, because a lot of what I do every single day is like after the fact, and I'd say our medical system is a little bit more geared towards like after the fact stuff. And so whatever people can be doing like before it gets to the point of they get to me, then that's like even better. Okay, true or false? I should apply triple antibiotic ointment to any cuts or scrapes so I don't get an infection. False. You guys are too smart. I think you got everything right. Okay, so generally I advise against it. People do this a lot. Triple antibiotic ointment, especially polysporin and neosporin, people tend to be not infrequently allergic to. They will get like something that is called like an allergic contact dermatitis, same as those natural products. So I say you don't need to use it like a cut or a scrape. You get it. What should you put on it? Vaseline. Okay, Vaseline's always the answer. You don't even need to come see me. It's always the answer. No, just kidding. But yes, Vaseline, right? Something that's bland. You don't need like the antibiotic stuff. I think they think that like the reason that maybe people found that it was helpful was that it was doing the same thing as Vaseline, because it makes the wound environment moist, not that the antibiotic aspect of it was actually like helping. So it's just when a wound is like moist and it's not allowed to dry out, it heals better. Yeah.
That relates to like I thought that the natural peeling off outer layers is stays.
That is really much more complicated level. This is about like little superficial cuts, like a 3rd-degree burn. I mean, someone is probably going to be admitted to the hospital, right? Like their whole, like your skin protects you. Like it is so high risk for infection. Like the things that burn patients are at risk of dying from is mostly infection, because you have lost all of that protection. Those usually do require like very gentle like dressing. Sometimes they require moist dressings. Usually they're not like debrided, except for very like specific like circumstances. You're not really trying to like debride. And so there's a whole, even I will say I'm not the expert at this. We see people, there's people who specialize in wound care. So wound care doctors and wound care teams will come see these patients, because it's not so simple. Okay, that was actually it. Yes.